Okay, I'm scanning the room. Okay.
Come in.
I'm going to close the door for privacy. Hi, Mr. Kadir. My name is Sabrina. I'm a student nurse at the University of Traverse. Can I have you say your name and your date of birth, please?
Ismail Kadirov, July 21st, 1994.
Are you in any pain?
No.
Do you have any allergies?
No.
Can I please check your wristband?
Yep.
Do you know what year it is?
2015.
Do you know where you are?
The hospital.
Do you know who's the president?
Barack Obama.
Patient is alert and already times 3. They are appropriate color for their ethnicity. They are their stated age, which is 20 years old, according to their birthday and their wristband. There is no foul odors or any type of smell coming from the patient. He is groomed very nicely, and he's dressed appropriately for the weather. He has no stated, there's no state of illness. He's not in any pain, and he's learning to time. So next, I'm going to check the temperature of your skin. So the skin is warm and dry to touch. There are no lesions, they are not asymmetrical, there are no irregular borders, no irregular colors, no irregular diameters or elevation. Hair is distributed equally. So next I'm going to check the eyes for perla. So first I'm going to check the right eye. Okay, and the next one I'm going to check conjunctiva. Okay, eyes do follow perla. His pupils are equal, round, and react to light accommodation. His eyes are symmetrical, his pupils are symmetrical, and also conjunctiva is pale and pink. Next, I'm going to check your mouth. Can I have you say ah? Okay. So patient's lips are a little bit dry, but it's appropriate for the weather. His teeth are straight and white. His gums do not recede. His oral mucosa is pale and pink and moist. There's no lesions, no scars. Also, his soft and hard palate are pink and moist. His tongue is pink and moist, no scars, no lesions. His uvula does react when saying ah, and his tonsil is about a 2+. Next, I'm going to check the carotid arteries. So one at each time. So carotid arteries are about 2+, and now I'm going to listen with my stethoscope with the bell for any brewing in 3 places. I'm just going to have you breathe normally. Okay, so there's no brewing present in the carotid arteries. So next I'm going to check the radial brachial pulse. So check radial pulse. This is a 2+. Brachial pulse is about a 1+. And then now I'm going to check the nails for clubbing and capillary refill. So first I'm going to check for capillary refill. So capillary refill is less than 3 seconds, and I'm going to go for clubbing. So I'm going to put your arm up a little bit. Okay, and the next one. So there's no clubbing present, and capillary refill is less than 3 seconds. So now I'm going to listen to the heart and lungs. The heart in each area, and the lungs in 10 places. Starting with my diaphragm, I'm going to start at the aortic area. And then next I'm going to go to the pulmonic, herbs, the tricuspid, and then mitral. At the mitral area, I will listen for 1 minute for the apical pulse. Okay, after listening for 1 minute, I'll listen to the apical pulse, and then I'll go back up the areas with my bell. So first I'm going to start back at the mitral area and go to tricuspid, herbs, pulmonic, and aortic. So next I'm going to listen to the lung sounds in 10 places, but I won't have a patient breathe 10 times in case of passing out. The first place, breathe, breathe. Okay, and then also listen for the 10 places of the lungs on the back. So I'm going to have you go a little bit. Listen. Breathe. Breathe in. Breathe. Okay. So when listening to the lungs, there are no adventitious sounds. Also when listening to the heart with my bell going back up, there are no murmurs or abnormal sounds. Next, I'm going to have you lay down, please. I'm going to take your shoes off. So now I'm going to do is check the abdomen. First on the abdomen, there are no scars or striations, there are no lesions. And then we look at the contour. The contour is flat. And the next I'm going to listen for all four quadrants for bowel sounds. So first I'll listen to the right upper quadrant. And then the right lower quadrant. The left lower quadrant. And then the left upper quadrant. Okay, so when listening, there are bowel sounds present in all four quadrants. The organs in the right upper quadrant are the liver. In the right lower quadrant is the appendix. In the left lower quadrant, there is the descending colon, and the left upper quadrant has the stomach. So now I'm going to percuss and palpate the abdomen for tenderness and for tympany. So first I'm going to percuss the right upper, and the right lower, the left lower, and the left upper. So when I percuss, there are sounds in tympany in all quadrants except for right upper quadrant is a little bit duller because of the liver. And then I'm going to palpate and tell me if anything hurts for tenderness. Does this hurt?
No.
Does this hurt?
No.
Does this hurt?
No.
Does this hurt?
No.
So patient did not notice any sign of tenderness in any area. Can I have you sit up, please? Okay. Next, I will check the popliteal pulse, the dorsal pedis pulse, and the tibial pulse. So first, I'll palpate the popliteal pulse to listen to feel it. So popliteal is about a 1 plus. Next, for the dorsalis pedis, I'll listen. I'll feel for it. Is about 2 plus, and tibial is about a 1 plus bilateral, and also the dorsalis pedis is 2 plus bilateral, and this popliteal is 1 plus bilateral. Next I'm going to have you stand up. I'm getting shoes. Okay, next I'm going to inspect for the costovertebral area, so I'm going to have to check it here. Okay, I'm going to hit it and tell me if it hurts. Does that hurt?
No.
Okay. And then next I'm going to do, can I have you touch your toes? So I'm going to, you can go back up. So I'm going to check the spine, and it's S-shaped, so it's a normal alignment. And then next, I'm going to check for the diameter. So, diameter, the anterior posterior diameter is 2 to 1. And then I'm going to have you sit back down, please, and lay down. So for the next test, I'm going to perform the Babinski test to see if we get positive or negative. On my finger. So patient does not react to the Babinski test, which is normal for his age. And then one more time, I'm going to have you get up, please. And then can you please stand up and close your eyes and have your hands to your side and stand for 30 seconds. So patient passes the Romberg's test. They are steady when they're standing. There's no swaying or falling, which makes them not at fall risk. And now I'm going to have them walk to that table and come back.